Hello everyone, Cpap Gentleman here, and we're going to take a look at why your Cpap therapy may be too noisy. Hey! Keep it down up there, I'm trying to shoot a video down here! Think snoring is difficult to listen to? Try falling asleep with a vacuum cleaner going off all night. The reality is, if Cpap therapy is working the way it's intended to, things should actually be pretty quiet. Remember, this kind of treatment has been around for a while, so the companies making these devices have refined them over the years, again and again. So let's address some common issues that end up in your therapy being a lot louder than usual. Mask fit. 9 times out of 10, when people ask me why their machine is so loud, it's a result of how well their mask is fitting. Cpap machines have a primary goal, and that involves maintaining a prescribed amount of air pressure that will effectively keep your airway from closing off at night. In an effort to achieve this, the machines will regulate the amount of airflow you receive in your mask based on the total amount of leak detected in the overall system. Now, every mask has a fixed leak in the form of exhalation ports. These are small little holes that vent out your exhaled air. Since this leak is intended and deliberate, its contribution to overall noise level is negligible. However, if your mask is not fitted appropriately, you'll get what's called an unintentional leak. Some examples of this include the mask is too loose, too tight, tilted to one side, or improperly positioned. Sometimes the mask you're using may not be best suited to your individual face, in which case trying another mask of the same style may be an appropriate option. You could also try a different face. Another noise contributor that goes hand in hand with mask fit is the actual age of the mask. Yes, masks do get old, and they do get worn down. The first piece to go is the silicone material, the primary component of your mask seal or cushion. Most manufacturers recommend replacing your seal every 6 months for not only effective therapy, but reduced infection risk as well. The next item we'll discuss is condensation. Perhaps the humidity level on your machine is set too high, in which case you may have a lot of water buildup in your Cpap tubing. This will almost always result in a gurgly type noise that you can easily prevent by either decreasing your humidity level, using an insulated tubing wrap, or investing in a heated tubing. Have you changed your machine's filter recently? Not changing the intake filters regularly may not only result in your motor having to work a lot harder than it has to, but it could also put your device at risk of breaking down in the long term. Have you checked all of the machine's connections? Any source of unintended leak will lead to high noise levels as mentioned earlier. One of the last causes of increased noise levels are high Cpap pressures, typically 15 centimeters of water or greater. Unfortunately, there's not much you can do about this one, other than trying a mask specifically designed to match those pressures. You can also try increasing the length of time it takes for your machine to ramp up to your prescribed pressure level. Hopefully that gave you some ideas as to why your Cpap therapy may be too loud. For more Cpap related awesomeness, subscribe, hit the like button, or just keep watching. If you don't do any of those things, well, that's okay. I'll just sit here, continue talking to myself. Cpap Gentleman, out.